It's going to affect the heart. It can cause the heart to beat too fast, or it can cause like a pounding heart. Because these nerves out of the midbrain affect the gut, it's going to create irritable bowel syndrome. It's also going to affect your urinary activity. It's going to set up a situation where you may develop chronic urinary infections, because if your bladder isn't voiding properly, there's going to be stasis of urine in the bladder, and that's going to attract infection. Also going to make your blood pressure go up, and can also give you symptoms like you have what they call fibro fog or flu-like symptoms. So, with our neurological-based treatment, we're going to do specific neurological tests to determine what parts of the brain are under firing, and then we're going to do therapies to get those areas of the brain firing properly. So your brain and your nerve system need two things to survive. They need fuel and they need activation. Fuel comes in the form of glucose, that's going to come from your digestive system, and it's also going to come from oxygen. Now, what's interesting about oxygen is the older you get, you actually lose the ability to metabolize oxygen. You become less efficient as you get older. So one of the neurological therapies that we do in our office is we put patients on oxygen to supplement. Your cerebellum, which is that very important part of the lower part of the brain, it needs more oxygen than your heart. So supplemental oxygen can be very helpful. We have patients exercise when they're on oxygen. When you move your arms, it fires very powerfully into the brain, and when you get the extra oxygen, it's going to help those nerve cells, those neurons function better. Now, some other therapies that we're going to use, and all these therapies that we do, there's a name that we call it. It's called brain-based therapy. So some of the other brain-based therapies, other than oxygen that we use, is we also use vibration therapy. When you put something that vibrates close up to your cerebellum, like the top of the shoulder, it fires very strongly into the cerebellum. So if we get that weak cerebellum firing better, it's going to help balance out that whole brain. Now remember, the cerebellum is very important for the tone of the spinal muscle, so any chronic pain syndrome that involves spinal pain is very important that we get the cerebellum functioning in an optimal way. Other therapies that we do, auditory therapy. We have patients listen to music just in one side of their ear. Visual therapy is very powerful for improving brain function. We may have people smell things in one nostril. We also may use warm water and put it up against where the eardrum is, and there's nerves behind the eardrum, and we put warm water in the ear. It's called a caloric. What it will do is it will fire very powerfully into the cerebellum, and it will help balance out the brain. We also may use non-surgical spinal decompression, which is a special table that we put patients on, and what it does is it rhythmically stretches the joints of the spine. We can use it for the low back or the neck, and this is also something that's very good if people come into our office who have stenosis, disc bulges, or herniated discs. So once we run all the necessary tests that we do, both neurologically and metabolically, we're going to be able to successfully treat you with our all-natural neurologic and metabolic therapies. Now, if you are serious about getting better, I want you to ask yourself the following questions. How has your condition affected your job? How has it affected your relationships? How has it affected your finances, your family? If you are a parent, can you play with your kids? If you're a grandparent, can you play with your grandchildren? Now, next question. What has this cost you in time, money, happiness, and lack of sleep? And where do you picture yourself in the next 1 to 3 years if your condition is not taken care of soon? Now you may say, well, my condition is so bad, how much worse can it get? Well, you probably said that 3 years ago. Now, statistically speaking, the average person is going to live to about age 75, 77. That's about 28,000 days of life. Now, if you're 50, you've only got 9,000 days left. So how do you want to live those 9,000 days? Do you want to continue to be debilitated, being a burden to your family, or do you want to be an active person that people enjoy being around? I can't answer these questions for you, but I can tell you what we can do to help your condition. What would it be worth you if we can improve your condition? Now, it's important to understand that insurance is not going to pay for all of the care that we provide in our office. We're not doing the same care that the doctors that you went to who were fully covered on insurance are doing. This is not status quo care. This is life-changing care that we're doing. So I don't want you to consult my office expecting your insurance company to pay everything, because it's not going to do that. So if you're serious about discovering what we can do to help you, what I want you to do is I want you to call my office. Give us a call at 425-821-1101 and tell our front desk that you're interested in setting up a consultation and a case review with me. Now, in that consultation, we're going to review your health history. We're going to do a very extensive examination. That examination is going to take over 1 hour to do. We're going to review some paperwork that you'll be filling out to get an idea of what's going on with you metabolically. For that very extensive review of your examination, that fee that we charge is normally $450. Now, because you've watched this DVD, we're going to give you an opportunity to have all that same testing done and with my time, and that same examination for just $120. But you must call and schedule and have that exam done within the next 2 weeks. Now, if you choose not to come in with 2 weeks, you're still welcome to come in, but the fee will be $450. Now, I only want you to consult my office if you are serious and very motivated about getting better. So if you really want to get better, I want you to take advantage of this offer. I want to help you change your life, but you're going to have to want it more than anything. We've discussed how we treat our patients both neurologically and metabolically. You've been to doctors who have basically just treated your diagnosis. It hasn't worked at all. We're not going to do that. Our care is completely different than that. We're going to treat you as an individual, and that's why our care is so effective, and that's how it's going to help you. So I would encourage you to give our office a call. I appreciate you watching our DVD, and I really look forward to meeting with you and discussing your health concerns.